All right, thank you for joining us tonight. You are attending Person-Centered Services Health Home Care Coordination Workshop. And your presenters for today are myself, Amy Albanese. I am the Community Relations Manager for our Eastern 10 counties. And we also have my counterpart, Christy Moscato, who's the Community Relations Manager for our Western 8 counties. So we always start with our mission, vision, and core values. So Person-Centered Services provides health home care coordination for over 17,000 people with intellectual and developmental disabilities in 18 counties, reaching throughout the Western New York, Finger Lakes, and Southern Tier regions. And I just wanted to mention, if you wanted to hold your questions till the end, we will do a live Q&A, or you can type them in the chat or question box, depending on which one you have access to. We'll be monitoring both throughout the presentation, and we will answer all questions at the end. And you will also get a follow-up email with a link to our community relations page on our website that has all of the resources and links from today's presentation. And then the recording will be on our YouTube channel as well as our website. And so back to about Person-Centered Services. So we are in all of the green 18 counties. And I cover from Monroe to Cayuga down to Chemung, and Christy covers our 8 Western counties. So our next slide is about why choosing Person-Centered Services. So in our region, there are 2 care coordination organizations families have a choice to choose between. And so we just wanted to talk about some specifics that make our organization different. So one of those being that under our stakeholder relations team, which is our community relations team, Christy and I, we also have provider relations, and we also have member relations. So our member relations managers, they're focusing on customer service, process, and advocacy for the people we support who cannot advocate for themselves. And also as parents who are the advocates for their children, you could also connect with our member relations manager. They work on a life plan approval committee for people who do not have guardians. So they do a lot of, advocacy and support to make sure the people we're supporting have a good experience. And they recently on that team created a care coordination introductory video and handbook. So there's a member relations page on our website that is very helpful. We can share the link to that as well. And our provider relations team puts on 4 care connection events throughout our regions. And it's an opportunity for care coordinators to come and spend a whole day learning about different topics and interacting with local agencies so that they're really learning and collaborating with the providers that they'll be referring your children to. We also have partnered with 2 different organizations to create a statewide community resource tool that has over 3,000 resources in it that providers, families, and care coordinators can access. We've also, in that collaboration with those other CCOs, have created a knowledge center. So just another tool on our website so that we really pride ourselves in having a lot of access for families to really get firsthand knowledge about different resources and supports and our care coordinators. We also on our website have an emergency preparedness webpage that, with winter coming, that's really helpful. And then we have a new member and provider portal. So the member and provider portal is a voluntary option that families and people we support have access to now. So for the first year for members, and like I mentioned, it is voluntary. So think of it kind of like whatever healthcare system, app, or electronic system you have for making appointments and things like that. Like for instance, in Rochester, I'm in a part of the MyChart system. So think of it kind of like that. And it allows members to receive increased access to additional information from all service providers in a way that is better coordinated between the providers and person-centered services. So the portal will foster stronger relationships between the care coordinators and the people that they're supporting by offering a convenient way to exchange information, ask questions, and review life plans. So this is a really nice visual of thinking of you and your child at the center and your care coordinator, and allowing that access to message securely, upload documents, view your child's life plan, which we'll talk about briefly later. You can electronically sign life plans and documents, which can be a barrier for some people, and just give you greater access to your support team.
Hey, Amy.
Yes.
I just want to interrupt real quick. A couple of people who are on the phone are having a tough time hearing. I haven't heard from anybody else that they're struggling hearing on their computer. I'm hearing it just fine. Yeah, those that are on a computer are hearing fine. So I don't know. I just let them know that we are recording it. Oh, Andre, it's better. Okay. So it might be better. I suggested they hop out and in and make sure their volume's turned on all the way.
And just like your suggestion that, if unfortunately they aren't able to resolve the technology issues, that they're more than welcome to access the recording.
Yes. Okay, thanks.
Yeah. So this is a snapshot of what someone's portal would look like. So it might be a little bit challenging to see, but if on this dashboard on the left-hand side, you can see that there's appointments, messages, health record, and a documentation system center. And then right here, right on the main screen, there's upcoming appointments, past appointments, messages. So it's just a really nice way for families to connect with their care coordinator and their support team. So next we're going to talk about care coordination. So care coordination is the main service and the only service that person-centered services provides. And our coordinators link, refer, and oversee all areas of a person's life. So they're going to link to different service providers and help make sure that the person that you're supporting, your child, is connected appropriately. So you heard me mention the word health home. So we are a health home care coordination organization. So what is a health home? A health home is not a physical place. A health home links to community supports and services. A health home coordinates resources, integrates primary care with behavioral health, and it's a partnership between the person, their family, and the care coordinator. So the care coordinators operate under 6 core services that we will review. So the first core service being comprehensive care management. So that is where the care coordinators are utilizing the person-centered planning process, facilitating the comprehensive assessment process, and developing and implementing a life plan. So after the first 90 days of enrollment, your child will have a life plan created that will be utilized for referring to different programs and gives a snapshot of your child. It's like an introduction, kind of like the life plan, and then discusses their goals and desires to make sure that, the programs are supporting the people appropriately. And that, like I said, after the first 90 days will be created. It will be reviewed every 6 months and a new plan in place every year. Next is care coordination and health promotion. So care coordination is more than just OPWD. So OPWD, which is Office for People with Developmental Disabilities, which Christy will dive into a little later, the services that are available under that system. But in order to get care coordination, your child would have to have OPWD eligibility. And in order to get any OPWD services, having the eligibility, you also have to have a care coordinator. So that is our main oversight, but care coordination is more than just the OPWD services and supports. This slide right here, there's a huge component of health promotion. So linkage to preventative health supports, evaluating the effectiveness of treatment plans and services, and coordinating and gathering all health-related information. Comprehensive transitional care. This is going to look different for every person based on their situation, and their age is going to play a huge factor with this. But facilitating discharge plans, ensuring follow-up after emergency department or hospital utilization, and support people during different phases of life transition. So that, again, could look different for every person. Individual and family support, another huge component of this, especially for parents with, school-age children. So facilitating the advocacy or rights promotion in all areas of the person's life, ensuring that services and supports are being delivered in the most culturally appropriate manner, and assisting the family or surrogate decision maker to be a meaningful member of the person's interdisciplinary team, also known as the IDT team. So this is a term you may be hearing as you begin this process. And then referral to community and social service support. So like I had mentioned, the connection to services is more than just the OPWD services. It's also linking people to community-based providers and engaging with non-OPWD providers to help meet the overall social needs a person may have. So there's a huge social connection component. It could be an OPWD provider to help meet that, but there's a lot of programs in different areas that can help meet that social need that are non-OPWD. And then also thinking of, the behavioral health and the mental health and medical and all of that, just making sure the health and the wellness of the person is supported. And then use of telehealth. So we've all seen a huge increase in this, since COVID. And especially with that new portal, there's that option to electronically sign records. There is on the parents can request to have their in-person quarterly face-to-face meetings be telehealth, but there has to be a request and approval process for that. But just allowing easier access to, electronic medical records and information. So next, we're going to talk briefly about the life plan. So that life plan, like I had mentioned, is created within the first 90 days of enrollment, and then will carry on throughout every year that a person is enrolled with person-centered services. So what is a life plan? So a life plan, there's different sections throughout it. So those sections include assessment and a narrative summary. So it gives that introduction to the service providers about your child, outcomes and support strategies, individual safeguards, waiver services, so those OPWD services, all supports and services funded and natural. So that's where all of the providers could be school, doctor, dentist, and behavioral, and everybody is listed in that section. So there is, in the beginning, creating this life plan, there's a PATHS assessment. So the life plan development is driven by the person with input and participation of all members of the care planning team. Through the person-centered planning process, the care coordinators are going to assist people with developmental disabilities to access services that support healthy, well-rounded, and fulfilling lives. So care coordinators work with the person and their family member and bring together their healthcare and developmental disability service providers, which you might not have those developmental disability providers early on in enrollment, since while you're creating this, but that's where it's reevaluated as the person changes and looked at every 6 months and every year. So that piece of the developmental disability service providers might not be added in until a little later on. And utilizing the person-centered planning process for each person, including developmental disability, medical, behavioral health, community, and social support. So remembering that all of those are encompassed in providing care coordination. And when I mentioned the safeguards section, which is bullet point number 3, this is a section about what keeps people safe, so that oversight. So example would be, what is their community supervision? What supervision is needed at home? Hygiene supports, their fire safety plan. And for school-age children, school could provide additional insight about the person's safeguards in school that may end up being important in this document, because it is a living document that is supposed to be shared with providers to help support the person appropriately. So I do think that is really important to have that school collaboration. And this is just a quick snapshot of 2 different examples of school-age children's My School Learning section. So this just really highlights how that importance of having the school care coordination collaboration, remembering that all the services and supports we link to are outside of school and meant to be supported for outside of the school day, where school is still meant to, complete all of their regulations, like the speech and OT and counseling and all of those things. But we do like to still incorporate what is happening for that child during the school day. Like the first example, they're in an 814 classroom. They do ride the bus. The family would like to get more educational advocacy support. So that's something a care coordinator could link them to. And then the second one is just written a little differently. So it shows, what type of classroom setting they're in and how much speech therapy and OT they're getting, and that they're not in the school transition age yet. So that survey has not been completed. So care coordinators play a huge role in transitioning. So 14 to 21 or 22, depending on if the child's staying, they are supporting with that process a lot. So to kind of just tie all this together about care coordination in school. So the care coordinators can support navigating the school system. So they're going to be there as an additional person during your meetings. The family member has to invite and initiate that invitation. And so they can attend the CSE meetings and link to community educational supports like educational advocacy if appropriate. But I do think it's important to bring them because then sharing school updates with the school team and then vice versa, where school can provide some input that might be important for care coordination. And then, as I mentioned, that transition age range. So we have an internal document called the transition checklist that is meant to be shared with school, family, and care coordinator to all stay on the same page of the different tasks that happen between each age bracket throughout the transition. So that's something that not all care coordinators use, but they are aware of it and have access and could use it if appropriate. So next, I kind of want to just dive into what is your responsibility as your child's advocate, or if your child is their, own legal advocate and you're just a support person. So when I'm talking about you, it could be you and your child, or your child and you supporting them. So, if we're looking at it from the lens of you being the primary parent advocate for your child, for your young child, looking at you driving the bus. So depending on the age of your child, you may be driving the bus with your child in the passenger seat. If your child is their own legal guardian, then they would be driving the bus with you in the passenger seat. So it is a really nice collaborative partnership that you will still be very heavily involved in if your child is their own legal guardian, and you'll just make sure that there's a consent signed by your child so that we have consent to involve you. And if you, as the parent caregiver, are driving the bus, this is a great opportunity for you to be teaching your child advocacy skills, if applicable, and involving them in the process. So thinking about these 4 different buckets of identify, communicate, follow through, and understand, that's your primary role in working with a care coordinator. And just remember, it is a voluntary service, so it does have to be reciprocal on both ends. So how you're driving the bus, identifying the best mode of communication. Is it email, phone, or text? Because you at minimum have to have contact with your care coordinator monthly. Could be more if needed. And then you'll have that quarterly face-to-face. Communicate as needs. Communicate your child's needs, wants, and changes. Follow through with any action items. And then understand that this is a team effort and we're all part of the same puzzle. So just diving into briefly a little bit more about those responsibilities under these, respond, communicate, make sure I understand and know who to contact. So we're just elaborating on it a little further. So your biggest responsibilities are to be responsive and to communicate with your care coordinator. Care coordinator may need things from you to help you get the services and supports you need. So if your care coordinator needs to hear from you or needs something, your responsibility is to collaborate with them and return phone calls and support with the process of the steps that are needed. So I think those are the big touch points, is just responding, communicating, making sure you understand what's needed and what needs to happen next, and knowing who to contact. So closing out that section on who to contact. So the care coordinators have a 48-hour rule that they have to respond back to you within 48 hours. Each care coordinator has a supervisor and a local director that's part of their team and should all be listed in their email signature. So Christy and I are always going to encourage you, if you're having challenges, to work up the chain of command. So always start with your care coordinator. If you're not having good success, then your next step would be contacting that supervisor. Then it would be the local director. And if it needs to go as far as the regional director or above, we'd be happy to provide you with that contact information. But we're always going to encourage you to work with the team to resolve any conflict or concerns. We also have a customer service line that you could reach out to with your concerns. And then our member relations manager, there's that link to their page. And so I highly recommend utilizing them as well. But hopefully you get your concerns resolved through the care coordinator, supervisor, and director, if there are any. And then you also had briefly heard me mention the interdisciplinary team, also known as the IDT team. So this is something that you'll start to hear a little more often as you begin the process, but I really like this visual. If you think of your child and you at the center, you want to bring the whole support team together. So who is supporting your child and who should be involved in these conversations to make sure that the needs are being met. So the different areas of people who you'd want a part of that IDT team would be natural supports, your care coordinator, any clinical support that may be involved, program providers, social supports, and who else? It could be your child's aide at school. It could be your neighbor or somebody else very heavily involved, a nanny, whoever that might be. So that will close out our, person-centered and care coordination specific information. And next we're going to move into intake and enrollment and OPWD eligibility services and supports. And I'm going to let Christy take that over.
Great, thanks, Amy. So now let's talk about, as Amy said, intake and enrollment. So the first slide that Amy's going to show us, she's going to advance it for us here, thank you, is who could be eligible for care coordination. So the listed diagnoses on there are what OPWDD considers qualifying diagnosis. So that would be that intellectual disability, which is a full scale IQ of 70 or below, cerebral palsy, epilepsy seizure disorder, familial dysautonomia, autism spectrum disorder, and Prader-Willi syndrome. Those are the qualifying specific diagnoses that are, specific to those diagnoses. But then you have your neurological impairment where your traumatic brain injury, spina bifida, Tourette's, and other neurocognitive diagnoses can fall under there. The last I heard, there were well over 3,000 diagnoses that could be considered a neurological impairment that could be a qualifying diagnosis for someone applying for OPWDD eligibility. The one big thing is whatever the disability is, the eligibility can be obtained at any time, but there has to be proof of the diagnosis of being obtained prior to age 22. So I know Amy and I both have worked with people well over the age of 22, but as long as there is proof of the diagnosis happening before age 22, that person could still be found eligible. One of the big things that OPWDD looks at is the adaptive assessments. So they look at how does this disability affect this person's ability to learn independently, learn new skills, be independent, and take care of themselves socially, emotionally, and physically. So the big thing with the adaptive assessments is making sure that we're answering these appropriately. So as parents, we are always building our kids up, and it's all about how amazing they are and all the amazing skills that they have. When you're filling out an adaptive assessment, which the schools typically use the Vineland or the ABAS, so you may remember filling one out that has 100+ questions, and the answers are sometimes, always, or never, looking at different skills, you have to be really honest with yourself and answer questions in terms of what the child does completely alone without prompts, reminders, or help of any kind. Thinking if they were left alone for a couple of days all by themselves, what would they actually do? Not what he or she can physically do. When you're answering these questions, it's not the time to give the kids the benefit of the doubt. It's to think of them on their worst day, being objective and critical. We know your kids have many strengths, but for this assessment in particular, OPWDD really wants to know what they struggle with doing independently. We need to remember that if you are prompting or reminding or supporting them in any way, that they are not completely independent and that they do need help doing that. So it's what will they actually do alone, not what they can physically do with help, prompts, reminders, or support. Now, there's a lot of documentation, and we all live in New York State, and we know New York State loves their paperwork, right? And this is no different. The eligibility documentation can seem like a lot, but we have an incredible intake team that will help with all of this. So OPWDD is going to want all years available of past psychological evaluations that the school district or outside entities have completed. I mentioned that adaptive assessment. They're going to want all the adaptive assessments available. They're going to want the current IEP or 504 accommodation plan. They're going to want a physical that's been signed within the last 12 months by an MD, an NP, or a DO. They're going to want a social developmental history or psychosocial report. They'll want a social evaluation that's been completed within the last 12 months. And if one has not been completed in the last 12 months, the intake staff will complete that with you and your family. If you're applying for provisional eligibility, which is children under the age of 7, they will want any early intervention or therapy evaluations that have been done. And then lastly, any and all medical documentation related to the diagnosis. So if they have an autism diagnosis, they're going to want, that diagnostic paperwork from whoever, whatever entity was the one who did the diagnosis, who gave you the diagnosis for your child. So another thing that OPWDD needs to see is that there's a reasonable indication of need for home and community-based services, or HCBS waiver services. And this is for ages 5 to either 18 to 21 or 22, like Amy mentioned before, that some districts are allowing children and it's feasible for kids to be in school till they're 22. So to meet reasonable indication of need for HCBS waiver, the child must need at least one waiver service, which we're going to talk about in a minute, which should be documented in their life plan, and there should be goals around those waiver services that you're interested in obtaining or you feel your child needs. They need that, and they need to require the service be at least monthly or require monthly monitoring if their service is less monthly, as documented in the life plan. So they want to see, so kids in school, as you can see by this graph here, they typically receive their services through their natural supports. So as Amy mentioned before, the family, the immediate as well as the extended family. We know that the school is doing their part with the IEP or the 504 plan, and that the Committee on Special Education is helping make sure all the right accommodations and modifications are in place for school. Any family support services, which I'll talk about in 1 second, and then as well as any community supports. Family support services here in this area is talking about OPWDD's family support services. So OPWDD contracts out through their family support services department to several agencies throughout the state that provide family support services. There's respite, there's recreation, there's behavior, there's parent training. There's a lot of different programs that are contracted out. Once OPWDD eligibility comes through, intake will share the family support services directory for your specific region. So they have access to the Finger Lakes one as well as the Western New York one for Region 1. And they'll share those, and that lists the organizations, what the programs are, the counties they serve, who the contact is, as well as a description of the program. So OPWDD will want to see, if you're applying for HCBS waiver, that you've exhausted all of these listed here: the natural supports, the school supports, the family support services, and the community supports. That being said, there's wait lists for just about all programs that are out there, but you'll have to do your part, thinking back of that, doing your part and, working with the care coordination team. Your part will be to contact the family support services programs that you're interested in, that you think your child needs, and, keeping a list of what did they say, how long their wait list is. I called this program, it's a 9-month wait list. Well, this program that's kind of similar has a 12-month wait list. Keeping track of that so there can be justification to OPWDD, the need for the waiver services through OPWDD. So the next slide we'll talk about briefly about some of these supports and services that are eligible, that are available or can be available. Again, most with wait lists. So there's self-direction, which is self-directed services you may have heard of, with budget authority. Included, if you decide to go down the self-direction path, which is its own path and can be its own training, there's something called self-hire respite or self-hire community habilitation. The community habilitation is typically for children ages 12 and up. Then there's agency-supported community habilitation, again, ages 12 and up, where the child would go to an agency, say an ARC, ARC Glow, ARC Erie County, different autism services, People Inc. programs, and, go and be with like-minded peers, work on social skills, work on some life skills, possibly go out in the community to go bowling or do some social activities. But that typically, as far as HCBS services, is typically ages 12 and up for the ComHab, or that's the nickname of it is ComHab. Or another service is respite. But in order to get the HCBS waiver for respite, you need two of the three listed there: in-home, site-based, and recreation. There's also assistive technology, environmental and or vehicle modifications, family education and training, or FETs. People Inc. I know has a lot of those trainings. There's programs on guardianship, on bullying, on, creating a binder, on advocacy skills. There's one on self-directed services. There's a lot of different trainings that they offer, either in small group or some of them are individual. And then there's transition and adult services. So dayhabilitation, also known as DayHab, pathways to employment, pre-vocational services, residential and supported employment. So I know a lot of these terms are new terms, but this just gives you kind of an overview of all the different programs that are out there and the services that are out there through the home and community-based services waiver. There's also, OPWDD also has behavioral and mental health services. So they have crisis services. So there's CSIDD, or New York START, for ages 6 and up. There's intensive behavioral supports. There's in-home behavior support, which typically, that asterisk is there because it's typically through family support services that offers the in-home behavior support. There's CHIRP of Monroe County, which is Community and Home Intervention and Response Program. Then there's mental health supports. There's different Article 16 clinics, and then there's presence development services. So now we're going to talk about what our referral process is specifically for person-centered services. So there's a few ways to get started. One is by completing a referral packet. Your school team can help you complete a referral packet, or you can contact Amy or I to help complete the referral packet. I was just on the phone before I hopped on this tonight, with a mom, getting some basic information. So Amy and I both do this so we can pre-fill out the consent forms that are needed. There's a 2-sided referral form that gets completed. There is a acknowledgement that you've received our privacy practices. Obviously, we share the privacy practices with you, and then there's consents. There's 4 initial consents that we absolutely need. One is for the primary care provider or the pediatrician. One is for the school district of residence. One is for OPWDD, and one is for your local county Department of Social Services. Then there's a blank consent in the packet for any specialist that you may see. And that blank consent, you can include as many blank consents or extra consents as needed. If they see a neurologist, if they were seen at, Robert Warner at Oshai Children's Hospital for an evaluation, and then they see a neurologist also for their epilepsy, we would want consents for both of those. But we will get the basic information, and then Amy and I will send it to our intake team, where a referral specialist will print everything up. They'll highlight what it is you need to complete. They'll get it all added to our internal tracker. They will then send you all that paperwork with it highlighted, what your part, what you need to do. Or remembering that if your child is 18 or older and they are their own legal guardian, they need to sign and date the consent forms. You can fill it out, but if they're their own legal guardian, meaning you have not gone to court and been seen by a judge to obtain legal guardianship, and that's once they're 18, they will need to sign it, and then if that's the case, if they're their own legal guardian, you would want to fill a consent out for yourself, to allow the care coordinator and the intake team and, anybody from person-centered services to be able to communicate with you. So that's one avenue you can go down. The referral specialist would mail it to you with a prepaid envelope, or discuss with you when they contact you about using Adobe Sign to sign the consents. You can also call our direct intake line, which the number was just on the screen, that 855 number, and a referral specialist will do all that Amy and I would help you with. The referral specialist would help with that. Once we get that ball rolling with that, that used to be, anybody who's ever heard this presentation before, OPWDD used to mandate that people attend front door information session. Well, they've gone away with that, but you are still required to call the front door at one of the 2 numbers listed there, the Finger Lakes number or the Western number, to basically open a case for your child. OPWDD's front door is like their intake department. So they're going to ask you a few demographic questions. They're going to open the case for your child, and then that allows us to submit all the paperwork once we've gathered all the documentation required. We cannot submit any of the documentation until that phone call and that case has been opened. So that phone call has been made and that your child's case has been opened with the front door. There's also, and so in lieu of the information session, there's front door videos. I think it's imperative for anybody looking to go down this route of OPWDD eligibility to take a minute and watch those videos. They're short video segments, which really goes into a lot more detail about the different programs and the supports and services, and it can answer a lot of your questions. And they're short little video snippets, like 6, 7, 8 minutes long that you can watch in your leisure time. When Amy and I work with somebody, we send them an email with this phone number and with the video link, because we, know the importance of those 2 steps being completed prior, and it's always best if it's prior to intake contacting you. So I love this visual. I've loved it my entire tenure at person-centered services because I think it's a good visual. So this is our process. So the intake and enrollment process is the first part is that referral packet that I just described, that is completed and returned. Once that is verified, that all the T's are crossed and the I's are dotted, an intake specialist will be assigned. That intake specialist will get your case, and then within 3 business days, they will get in touch with you. They will do that social summary. They're going to check if you've contacted the front door. If you haven't, they're going to reiterate the importance of that and share that number with you. And then they are going to start tracking down all the documentation required. They're going to start contacting the primary care doctor, the school district, the specialist, the county. They're going to start gathering all that paperwork. Once they have everything they need, they're going to submit it all for review to OPWDD. One of 3 decisions will come down. Yes, your child is eligible. No, they are not eligible, which at that point, you may choose to appeal, and intake can help you begin that process. Or we need a little more information, which could be they want an updated psychological, they want an updated physical, whatever the case may be that OPWDD, feels that they need more information on to make a fully educated decision. Once that eligibility comes back, that yes, your child is eligible. If your child does not have Medicaid, our intake team will assist in applying for Medicaid for your child. That's where that family support services can really come into handy, making sure that as soon as you are found eligible, even while they're applying for Medicaid for you, if your child doesn't already have it, in order to qualify for those waiver services, you're going to want to contact those family support services and start making a list of who you contacted and what the outcome was. So in a perfect world, all these things, you get the green light on all of these things. Your child is, you choose, again, this is you are choosing to enroll in care coordination because you feel you want a case manager and need a case manager for your child's care. Once all of that is done, you will then be enrolled into our care coordination program. That being said, this is not a process that happens overnight. It does not just take a month. I tell families, plan on about 6 months. It can be less, it can be more. It really depends on how quick we get all the documentation and on how busy OPWDD was. Once everything goes to them, it is reviewed locally and then it is reviewed up in Albany. So, it is a process. But in the meantime, we have a lot of great resources that you can tap into while this process is happening. So, and these resources all can be found right on our website as well, on our community relations webpage. We have a person-centered services YouTube channel. So this recording, along with everything else we record, goes up on our YouTube channel. We also have an events calendar right on our webpage. So at the top banner, there's an events tab. You can see where Amy and I are going to be, as well as other events that might be happening in your area. OPWDD has specific Facebook groups. They have one for, in general, they have a family support service Facebook group. They also have a self-direction Facebook group. So if self-direction is something that you think you might want to do at some point, that could be a good place to start. I mentioned that family support services directory, that is also available on the website. There's a self-direction informational website. It's called In the Driver's Seat. That's a great website to start learning the terms and familiarizing yourself with self-direction if you think that might be something that you might want to access in the future. I find it very parent-friendly. There's Parent to Parent of New York State. They do a lot of great free trainings regionally. There's Parent Network of Western New York. They do a lot of great free trainings no matter where you live. I've had when I worked there previously, and I had somebody from California attend a training I did once. There will be a PDF with the links available that will be sent to you after the training. Now we have some other upcoming events coming up. Our next one coming up is in December. Amy and I do that engagement series that she mentioned early on. We do quarterly engagement series every year. And the last one of this year will be on Thursday, December 12th, and that is on multiple diagnoses. In January, our first one for 2025 will be What is Access VR? You may have heard about that from school, and we have Sarah Wolf from Access VR giving the training. And then in April, I'm doing a How to Be an Effective Advocate. And that's a lot of talking about how to advocate in a positive and collaborative way for your child. Lastly, in January 22nd and 23rd of 2025, we are doing our 4th annual Transition Services Expo. So if your child is that transition aged 14 to 21 or 22, this night is for you. Please mark your calendar now or click the scan the QR code and get registered. This is a way for you to meet and interact with local providers in your region who offer services supporting that successful transition into adulthood. So once your kids, exit school, what's the plan? So we have a lot of different programs and different agencies host breakout rooms where you can come in. We hold it on Zoom. You can pop in. We want you to come with your child, and you can pop in and out of the different breakout rooms to learn about the different programs. You're sent a passport prior to that night, where you can kind of see what agencies will be there, what counties they serve, and then you can make your decision and kind of set your game plan for that night. So I highly recommend you attending, especially if you're just now thinking, wow, you know what, my child's going to be transitioning in a couple of years or next year or this year. We do have to come up with a plan. And as a parent of a transitioning student myself, I hear you on that. So it really is a great night. So we hope to see you there. So, we want to share our contact information with you. We want to hear from you. Amy's contact information is on the top, and it lists the 10 counties she covers. Mine is on the bottom with the 8 counties I cover. You can text us, you can call us, you can email us. I always, say, just remember, Amy and I are on the road a lot. So we might not be able to get back to you, especially if we're at like tomorrow, I'm at an all-day conference. So just be patient with us, but we're pretty timely in returning our voicemails and our text and email messages. So please reach out to us. And then lastly, while we open it up for Q&A, we appreciate all feedback. So if you could scan the QR code to share your thoughts and any thoughts on any upcoming sessions you would be interested in attending, or for future engagement series sessions, please share that feedback with us. And with that, we will open it up for Q&A. You can either type your question or unmute yourself and ask the question. It's your choice. But we really do appreciate you taking the time to spend the last hour or so with us. And if you think of a question tomorrow or Friday or Monday, jot it down and give us a call. Ramesh, we typically, we can PDF the slides and share that with the group that's here. We'd be happy to do that.
You'll be getting a follow-up email in a few days, and I'll include the PDF slide deck and some additional attachments and a link to our community relations page on the website where a lot of these resources are housed, and I'll provide you all that in an email within a few days.
Perfect. Andre, are we still being glitchy and you can't unmute your mic? trying to see. So your child lost their OPWDD. So I'm confused by what you mean. Oh, it's still disabled. I'm sorry, Andre. Let me see if I can go into the settings while.
May have been from provisional eligibility.
Oh, yep, that's a good point. Was that the case? It was provisional eligibility? Was she under 7 or under? I'm trying to unmute. Okay, wait, let me see. I heard a message pop up. Due to her being switched from Medicaid to Child Health Plus. Yeah, well, but that shouldn't have caused her to lose her Medicaid, her OPWDD status, right, Amy?
Well,
She could have lost her care coordination.
Yeah, so your child may still have active OPWD eligibility, right, but because the Medicaid was lost and it switched to Child Health Plus, there may have been some difficulty obtaining the Medicaid through our system based on disability versus income. So that's something you could definitely reconnect with our intake department and have them, provide you a little more information, or reach out to Christy or I. We could look into a little bit, and it may be that you need to wait until the child's a little older for that community habilitation that is really helpful, like 12 and up. But I think we should probably do a little more investigating for you if you want to connect with Christy or I. And our contact information will be in the follow-up email as well as on the screen.
Yeah, for some reason I went in to change the allowing you guys to unmute yourself, and it's grayed out for me, but it's probably because we are in the middle of the session, so I apologize for that. But yeah, so Margaret, whichever region you're in, just reach out to Amy or I, and we will do a little bit more digging on that. I apologize about the mics, guys. Teams is still a little bit newer for us, and we're still learning the setup, but I know we've had people talk in past ones, so I don't understand why it's not, the settings weren't the same, so I do apologize. Grace typing, and I know you're on your phone. I'm so sorry. I have a question in the Q&A here. My son is OPWDD eligible, but we don't have a life plan or care coordinator. Is that something that will change in the future? How do I know if I should advocate for adding those? So Lisa, did you ever enroll? My question would be, if you have not enrolled in care coordination, you would not have a life plan. So, yes, you could have that eligibility without being enrolled in person-centered services, or the other care coordination organization in our region is Prime Care. Every region has at least 2. So if that's not familiar to you either, and you are interested in enrolling in our health home, that's absolutely something that, we could do. And then once that happens, if you feel you need a care coordinator, or that person to, be that linkage to all the supports and services that are available, you absolutely still can do that. Especially already having the eligibility, that piece is, you've got that big box checked already. But now we would just, if your son does not have Medicaid, either way, you'd have to contact our intake department, fill out consent forms, let OPWDD know you're going to go with us, and then intake would be able to help you with all of those things. And if you feel things are going fine and you do not need care coordination, you don't need to have a care coordinator. But for a lot of the different programs and services out there, you have to have one, and you have to, be referred to the program by your care coordinator.
And the only reason I can think of why it didn't, move to enrollment was because of the Medicaid component, which because there's usually not many other reasons why once eligibility is obtained that the person doesn't enroll in care coordination. So
Yeah.
I would suggest contacting Christy or I, emailing us to schedule a phone call if you were with person centered and you want us to look into it a little bit more. But I have a feeling it might be because of that Medicaid piece, which, may still be a challenge for a little while. But if you have eligibility, any family support service you can continue to access. So I would encourage you to access those and then follow up with us if you're
That's
interested in.
exactly what it is, Amy. She said that when he became eligible, she was told that unlikely that he would be approved for a care coordinator. So
Yeah.
So, that means that like we were talking about before, is that, having the need, you have to exhaust all your natural supports and the family supports and, have that justification of need for services. So, looking at that family support service guide, kind of as a guide to what services and supports do you think that your son needs, and then reaching back out to intake to say, okay, now we might have only needed respite, but now we need in-home behavior, and we need him in some social skills programs, and we need parent training, like showing a higher need. The more need there is, the more, the higher the chance that, he would be able to get that waiver if Medicaid was the piece.
Whoever you were working with should have still attempted to apply for the Medicaid. And if there was a denial, you could have appealed it. So I would again suggest reaching out to us. We can try to look into it a little further, but they should not have discharged you from intake without at least trying to get you the Medicaid.
Right. So somebody was saying, can we apply for Medicaid before intake process starts?
You would want to do that if you believe you could qualify based on income, where with our process, once a child's eligible, if then approved for those waiver services we reviewed, you would then be most likely granted Medicaid eligibility based on disability, and your income gets waived. That's a specific process to OPWD. But if you believe you could qualify based on income, then it may not hurt to try that process before coming to intake.
Yes. So Andre, I'm seeing your message here. So if someone has an initial budget, can they switch to care coordination? Do you mean, can you switch coordinators? Because you have to have a care coordinator to do self-direction. So you must have one. That is a waiver service. So you have the waiver, which is good, but I'm assuming it means that I'm assuming you're saying you want to switch care coordinators. And yes, you can. You can request a new, yes. Oh, to person-centered services, yes. You can still do a change of vendor from prime care to person-centered services, or vice versa at any time. We still would need to fill out that, initial referral packet just so we can access all the records. But that's something Amy or I could help you with.
And so the change of vendor process is actually significantly easier. So if that's something you're interested in, I suggest contacting Christy or I via email. We'll schedule a quick call, or we can get your information via email and make it expedite. And then it goes specifically straight to our change of vendor intake specialist, and she takes it from there. So you don't upfront need all of the referral consents, but they'll work on getting you everything you need and following you along through the change of vendor process.
Yeah.
But I would say email either of us if you want to explore transferring.
Will the initial budget stay the same? Yes, it won't affect his budget or her budget. It's just really some behind the scenes stuff that intake does to switch things over. And with, ensuring continuity of services that, prime care will stop one day and we will start the next day.
We'll stay on for a few more minutes if anyone has any last minute questions, and we'll get you that follow-up email in a few days. And we do really highly encourage you to fill out our survey so we can continue improving and provide new trainings that are of interest to families. But Chrissy and
Andre,
I
I
are
just
here to
want
help.
I do just have one more question here from Andre. So, is there an option to choose a care manager, broker, and FI? The short answer is no. Because, and I can explain it, the broker, yes, absolutely. You can pick your broker. Then that broker will inform you and the care coordinator which FI agencies they do work with. And then it is really based on which FI organization has availability, has room. Like I know my FI agency is Heritage Christian, and I know they have kind of had a freeze on taking new people just because they with the waiting for the budget to go through for the state as well as capacity of FI staff. They, are now reopening it, but I know that there was kind of like a hold where people were kind of in a holding pattern. A broker, absolutely, you can choose. A care manager, you can change them, or care coordinator. If you're not happy, that's where that supervisor and following that kind of chain, the supervisor and then the local director can help. If there needs to be a change, but you can't, based on caseloads, and there's a lot of things that go into play with who gets assigned, who you get assigned to, and part of it is caseloads and experience, and maybe what services it is that you're looking for. It could be, I'm not sure how Prime Care does it. So that there's a lot of factors at play that is how a care coordinator is assigned to a specific person. But it's not something that you could say, hey, I know Sally Smith works there, could I have her? You could always request it, but there's no guarantee. So thank you, everybody, for taking the time to time out of your busy day to spend it with us. We really appreciate it. You have our contact information is right there on the screen. Please reach out at any time. Amy and I will be happy to help and to do a little bit digging if we need to do a little bit digging on anything. So thank you very much and have a great night.